Okay, Adam, so we're going to talk about longevity, which I think when you say the term longevity, I think everyone goes, what does that really mean?
Yeah.
But what does it mean? And what does it mean in relation particularly to men? How can men improve their longevity?
Well, I mean, longevity is quite a buzzword at the moment. And but the basic underlying thing is, how do you live a longer, healthier life? And how do you live more of your life healthily? So we often see at the end of people's lives, obviously the health deteriorates and quality of life can be impacted. So how do you prevent that happening? And really, there's no time that's too early to start thinking about that. I mean, really, we see in the UK, often we see even children with obesity problems and things. So we should be encouraging thinking about this all the way through life, from childhood up to old age. And equally, it's never too late to start thinking about how do you improve your lifestyle? How do you improve your health? There are lots of things you can do, most of which won't come as a huge surprise. The foundation of it really is eating a healthy diet, avoiding really high processed foods, avoiding too much sugar, avoiding too much fat, and exercising regularly. And so people should be aiming to incorporate exercise into their daily life, just being more active. It's not necessarily all about going to the gym, although for some people clearly that will play a part. It's just about finding a way to keep yourself moving and keep yourself active. Then there are, I suppose, more sort of medical side of how you keep yourself healthy. And there's a huge range of things that would include. Really important things that it might include are, for example, I know you asked me about men, but for women, attending things like cervical screening, mammograms, so that if the worst happens and you develop breast cancer or cervical cancer, it gets picked up early. And making sure you act on unusual symptoms you're getting, and actually this is something that men are particularly bad at, is ignoring symptoms really until they progress to a stage that actually is a bit later than you'd want to start treating them. For men, there's important things they can do around checking themselves, checking their testicles, for example, making sure there's no lumps and bumps. And for older men, prostate cancer is very common, and making sure they seek help if they've noticed a change in urinary symptoms. So difficulty passing urine or getting up lots at night to pee, those kind of symptoms. The other thing that isn't just important for men, but is perhaps more important for men in some respects is sort of cardiovascular risk, because men tend to be a bit higher risk of heart attacks and strokes and other cardiovascular disease. Again, lifestyle plays a huge part in that. Not smoking is a really big one. There is almost no part of the body that smoking doesn't harm. So definitely encourage anybody to stop smoking, and other lifestyle things like drinking alcohol in moderation. We've already mentioned sort of diet and exercise. But there are blood tests that can help assess your cardiovascular risk. So you want to look at blood sugar levels to make sure you're not pre-diabetic or diabetic. You check your cholesterol levels, because a raised cholesterol increases your risk of heart attacks and strokes. And then there are other markers of ill health, like the kidney's not functioning well, or the liver function being elevated or deranged, we would say, which is sometimes a sign of fatty liver, which is sort of the manifestation in the liver of an unhealthy lifestyle. So those are things that people can get checked for themselves.
Do you think there's more of an interest in people understanding more about their general health and their longevity these days than previously?
I think there's a real shift at the moment into people taking an interest. There is obviously more access to things. So, for example, obviously here at One Day Tests, we do blood tests for blood sugar levels and cholesterol tests. And we, in fact, have a blood test called the longevity test, which has a huge range of biomarkers that is a sort of whole health MOT. But I think generally people are very interested in their health now, and they are aware of the risks of bad diet and a sedentary lifestyle. Certainly when we see people coming through our One Day Tests GP service, our patients tend to be very well informed, highly motivated, and really interested in drilling down in the detail of their health so they can make changes for themselves.
And that's, I think, I've seen that change really from digital health and apps that people can input data so that they can be provided with insights. And that's really valuable, isn't it, to get them interested and motivated with their health?
Yeah, I think there's two roles in that. One is being able to track it. Yeah. And actually being aware of what's happening in your body. And the other is the motivation, being able to see the change as it happens, and keep the change going.
Yeah. Yeah. And I thought it was really interesting when you said at the very beginning there that, it should be something that we're paying attention to when we're even young children, thinking about longevity.
Yeah.
Do you think we're there yet? Do you think young children are thinking or being told, informed and advised on their health for the future, or is that a difficult concept?
Yeah, I mean, it's I think it's a difficult concept for the children themselves perhaps to understand, but it's not a difficult concept for the adults around them to help them with. There are programs in place that will help, there are programs in schools, in primary schools, where they'll look at the height and weight of children. But probably in general, we're not really quite there in terms of activity levels for children and, giving kids the best diet that they should have.
No.
And I think that's really important. I mean, we talked a little bit about there's never a time too early or too late to look after your health. And taking exercise as an example, there's really good evidence that exercise is beneficial all through life, childhood, during pregnancy, in the postpartum period, and especially for older people who really should be maintaining activity in order to maintain their bone health and their muscular health and reduce their risk of falls, amongst a huge wide range of other health benefits.
And what do you recommend to somebody who might be concerned that perhaps their health isn't going in the right direction? And who should they go and talk to? What investigations should they get done?
Yeah, I mean, obviously speaking to a doctor or other healthcare professional is a good place to start. There is a wealth of information out there. The NHS website is very good. There are other good health websites that will give you lots of information. And if you want the more sort of biochemical knowledge about blood tests and things, then you can get blood tests. And obviously at One Day Tests, we do the blood tests. And you can look at you can look at any system of your body and test, get blood tests done to make sure that it's in good health. Yeah,
which would be so useful, wouldn't it, to have that knowledge?
Yeah, well, it gives you either reassurance or something to work on.
Yeah, absolutely. So Adam, at One Day Test, we have a longevity consultation. Can you explain a little bit more about what's involved in that?
Yes. So the longevity consultation is run by some of our GPs who have a specialist interest in lifestyle medicine. And the basis of that really is taking a really broad overview of your whole lifestyle. And that will include, how we sleep, your social activity, your work life, as well as how much activity you undertake, what your diet's like, all the kind of things you'd expect to impact on your overall health and well-being, really. As part of our package for that, there is a blood test, the longevity blood test, which has, I think, over 60 different biomarkers in it.
Wow.
Yeah, it's very comprehensive sort of health MOT. We'll check all the things you might expect, like cholesterol and blood sugar levels, as well as kidney health, liver health, your full blood count, which will give you an indication about your immune system, and some hormone checks as well. All of that information feeds into the consultation, which is a long consultation, at the end of which you will come out with a very sort of personalized plan, which is tailored towards what you want to achieve and how you move from where you are now to where you want to be, which will be different for every patient.
Yeah, God, sounds excellent now. I want to have one.
Yeah.